From the Toronto Star, I'm Saba Eitizaz, and this matters.
In terms of wearing a mask, I'm at home most of the time. I'm practicing social distancing. This is probably the first time I've been outside in a week or 2 weeks.
For months, Canadians shut themselves in and the rest of the world out as the pandemic took hold. Now, across Canada, governments are beginning to ease social restrictions, even though many of us are still worried about catching the disease.
To the COVID-19 crisis, Prime Minister Justin Trudeau has spoken with provincial and territorial leaders about plans for the eventual reopening of the economy. The two levels of government have agreed to develop guidelines to balance national coordination with flexibility for provinces to move at their own pace.
Ontario, with the second highest number of confirmed cases in the country, is also reopening in slow planned stages. We're at stage 1 of the province's grand economic reopening plan. The government has announced an extension of all current pandemic-related emergency orders for at least another 2 more weeks. So while some seasonal businesses and retail outlets are reopening for curbside pickup, non-essential ones are still closed. And we still have restrictions on gatherings of more than 5 people. Meanwhile, as we emerge slowly and fearfully from a lockdown that may have changed Canada forever, we all have questions about what exactly the new rules are. How do we manage work, travel, and a home life? What we can and can't do while staying safe, healthy, and connected. The virus that made it too dangerous to go out is still spreading. So how do we navigate the risk? In today's episode, we try to make sense of the complex and often conflicting information and messages about COVID-19 and weigh the pros and cons of provincial lockdown strategies. I talked to Dr. Vivek Goel, who's U of T's Vice President Research and Initiatives. He's also a professor at the Lana School of Public Health and was also the founding head of Public Health Ontario, which was set up in response to the SARS outbreak. Thanks for joining us, Dr. Goel.
Hello.
So it seems to be a bit of a paradox. The nasty pathogen that drove us all inside is still spreading, but now we're being told it's time to go out and face the risk. Can you tell us what's behind the strategy in terms of how we are dealing with COVID-19?
Sure. And I think it's important that we first go back and remind ourselves why we went into the lockdowns. We did not do this to protect individuals such as ourselves likely, who are healthy and young, from getting COVID-19. We did it to protect those who are in the highest risk groups, those who are older, those with pre-existing health conditions that might make them immunocompromised. And if the virus had been allowed to run rampant in our communities, we would have overwhelmed the healthcare systems like we saw in Italy and New York City in early March. And so we never did this as a strategy to completely stop the spread of COVID-19. And so as we go back out there, we have to get our mindset out of every case is a problem and every case represents a failure on someone's part to we have to learn to live with COVID-19. In the vast, vast majority of people, they either have no symptoms or they have relatively minor symptoms like the common cold or flu. And it's only a small minority of people that wind up being hospitalized. And it is a greater risk in those people who have the pre-existing conditions or are older. The reason why COVID-19 was such a threat is it's a new virus for which we had no pre-existing population immunity. But otherwise, it's not actually that different than a lot of other respiratory infections we deal with every year.
So continuing from what you said earlier, this easing of restrictions, this policy, do you think it's aimed towards a form of stimulated herd immunity? I mean, we know there's still no treatment for this and a vaccine is probably years away. So is this our best bet right now?
Certainly our way out of this and getting back to the way things were before March is going to be getting to population immunity. As you say, a vaccine is going to take a long time. Developing herd immunity is a possibility. Right now, we don't know what the degree or duration of immunity is in people who've had COVID-19. There's a lot of research being done on that. And then we'd have to obviously get to safe levels of immunity by having people infected without overwhelming our healthcare system and having the people who are most vulnerable get it. So that could be a strategy down the line. But I would say right now what we're seeing is the balancing of what the impact of the public health measures, the restrictions are on people. And I know there's a lot of conversation about sort of the balance between COVID-19 and economic indicators. And obviously, we've had a huge hit to Canada's economy as a result of this. But I would actually say we have to look at it from a health perspective as well. There are very significant health risks to continuing with the shutdowns that we have. We have people waiting for their surgeries and medical procedures. Unfortunately, some of those people will die. Many of them are suffering from pain and anguish as a result of the wait. We have increases in domestic violence and child abuse. We have increased incidence of mental health issues. We have poor physical activity and reduced nutritional intakes for people as a result of the economic hardships. And we actually know that recessions lead to increased death rates. So my point is simply coming out of the restrictions actually is about balancing the health consequences of the restrictions with the possible risks with COVID-19 disease.
Right. And at the same time, lifting of restrictions comes with unprecedented questions like whether collective obligations override personal preferences. For example, should everyone be required to wear masks to protect bus drivers and fellow transit riders? Or can you be prevented from entering a store if your temperature is high? Do you see this as a space for governments to adopt more policies and guidelines around this? Or are individuals going to have to do it?
I do think we need very clear guidance from our governments on some of those things that you just raised. We don't have clear guidance on what sort of screening should be done as people enter a store or their workplace or a classroom. And it could be temperature checks, it could be questionnaires. We have a lot of speculation about should employers be doing their own testing as different tests become available. And certainly the issue of masks, when they're appropriate and whether you're wearing them to protect yourself or protect others is a complex one. And I think there are going to be some very difficult discussions for us as a society. As we said earlier, it's going to be some months, if not years, before we get to immunity. And so even before we get to masks, there's what do you do if someone's not keeping 2 feet away from you? And do you have the right to ask them to step away? So there's going to be a whole new set of social norms that we will need to develop as we go forward.
And obviously, we're figuring this out, how to navigate this as we go along. But do you have any advice or insights for people on how they can navigate the risks right now a little better as they come out of lockdown mode?
Again, I go back to, in many respects, COVID-19 is like the seasonal flu. Our most important tools are the things that public health people keep saying over and over again. Washing your hands frequently, not touching your face or mouth, staying home if you develop symptoms. So those very basic public health measures will do the most to protect an individual. And so before we get to talking about masks and other things, if we can get everyone to adopt those practices and be conscientious about that, we go a very, very long way towards reducing risks.
And a lot of experts are also talking about the possibility of a second lockdown. For example, if people are clustering together, if we see pockets of infection and those pockets spreading to other places. What's your assessment? Will there be a second wave of COVID-19? And how bad could that be?
At this stage, it's very hard to predict because there's really not that much experience. The virus has still only been around for about 4 months, but certainly it's likely that the virus will be with us for some time to come, and it will come in recurrent periods of time. I think what we certainly will have is we will have clusters of cases sporadically popping up from time to time, and it could be 1 week somewhere here in Toronto and another week up in Barrie. And so we'll see it, and we'll have to be able to move and make sure we can get adequate resources from a public health and health system perspective to where it comes up so we can contain the cases as quickly as possible. That's why people talk about testing and contact tracing. There is the possibility that we'll have another surge, another wave, either sometime over the summer or in the fall. And the concern with a fall wave is it comes at the same time as our regular seasonal influenza. And again, that puts a greater pressure on the health system. But if people are taking the precautions that we just talked about, if we maintain physical distancing, we can certainly do a lot to reduce the risk of a second wave. So, what public health authorities are going to be doing is relaxing the measures enough to allow us to get restarted, but also keeping a close eye on the numbers and trying to keep us from crossing the threshold that we reached back in early March.
You actually led me right into the next question. I wanted to talk about testing and contact tracing. Is building up capacity to do that the key to fend off a second wave? And how do you see Ontario's approach to that, even as we move towards easing lockdown? Keeping that in mind, and also that there's been some discrepancies regarding data, do you think we might be moving too fast at this point?
First of all, I would actually say the province of Ontario has been moving very carefully, and they've been laying out their plans. Their framework was released a couple of weeks ago. They've released guidance for workplaces, and they have been working on the testing and the contact tracing capacity, as well as the health system capacity issues. We're talking about a very careful, slow process of moving from one phase to the next with 2 to 4 week periods. So I don't see a danger that we're moving at too rapid a pace. We're certainly not doing like what we saw in some U.S. states where people are told, tomorrow morning or in a couple of days, just open up. We're moving at a careful pace. In terms of testing, there is quite a bit of testing capacity in the province, and it continues to be added to on a regular basis. One of the things we have to do is we have to be very careful and smart in the way in which we test. Random testing, or we'll see claims that we would like to test everyone going into a sports stadium, so on, is not necessarily the best way to use the testing resources that we have. As I said, testing people who have symptoms and those who are the contacts of confirmed cases, and being able to rapidly reach those people, testing people who are working in the highest risk settings, like the long-term care facilities, the meatpacking plants, being able to reach those people. So what I see the province working on is strategies to ensure that the testing can be available where it's needed and when it's needed. I think we've gotten into trouble is sometimes when people try to do too much testing of the wrong type, and then we're not having it available where it's needed.
Dr. Goel, we're seeing Canada's two most populous provinces choosing widely different paths as they talk about their reopening strategies. I'm talking about Ontario's sort of cautious approach, as you mentioned, and Quebec's more bolder approach. How does Ontario's strategy compare with Quebec's? And also on the other side of the spectrum, BC's, where rather than shutting down the economy completely, the government allowed many businesses to operate while managing the outbreak. So how do you see Ontario's stance on this?
Every province has been different in terms of its local epidemiology, and so that's and the timing of that. And so that's driven the decisions, and the different provinces had different exposures in terms of international travel coming in, and that also drove how the outbreak started and what decisions were made early on. And so, certainly BC never got to the exponential rates of growth that Ontario and Quebec were at in early March. And so they were able to do similar actions at about the same period of time. They also didn't have the same time for their March break and all the related travel. And so the travel shutdowns that came in from the federal government actually were more helpful for BC. Quebec had its reading week or school break a week before Ontario, and they had many people from Quebec go to Europe for that week. And so unfortunately, those returning travelers brought the disease into Quebec. So first of all, the geography has been very different across the provinces. And then within the provinces, it's also very different. Toronto and Montreal are largely the epicenters of the outbreak in each of their respective provinces. And so what Quebec has been doing is actually opening up outside of the greater Montreal area to a greater degree, because they actually have had relatively low rates of community spread in those regions. And in recent days, they've actually been putting off the reopening of schools and stores in Montreal. So I think what they're doing in Montreal actually looks a lot more like what Ontario is doing. And what they're doing in the rest of the province is probably looking more like BC. So the bottom line for me is the right things are happening here. Canada is a vast country with many different levels of population density and so on. So to try to do things in a uniform way would not be the best thing for the population. We have common principles, and then decisions are being made on a local level.
What was your experience like during the SARS epidemic? It's a tough balancing act, isn't it? Pitting economic and social imperatives against public health. What strategies or lessons can we take from how we dealt with SARS? Although I know this is not exactly the same situation.
With SARS, first of all, it was for Canada, it was quite localized. So it's one region, the Greater Toronto Area was largely the region that was affected. And it was essentially over in about a 4-month period. We also didn't have to shut down the economy because it was largely within the hospital system. It's not really as comparable in terms of what the economic impacts were. But again, as I said earlier, I think we shouldn't think of it as an economic versus health. We should actually take a broad population health perspective and look at what the health consequences of the social distancing and other measures are. And when we look at that way, I think we have to ask ourselves the questions, how long, from a health perspective, can we continue to keep people locked up in their homes?
And there's been some global alarm. First, a resurgence of cases in Germany after they eased some restrictions. And we know that Germany was being considered the most successful European country in halting the spread through an expansive testing program. And now we are seeing more cases in China after the country designated all regions as low or medium risk. From a scientific viewpoint, is this kind of resurgence inevitable, or can we glean something from this in terms of how we navigate our lockdown?
It is inevitable. This is a disease that's going to be with us for some time to come. And, while there are cases in South Korea and Germany and China, they are responding, they are containing those outbreaks, and they're moving on. We can't get back to our social sort of structures and work and so on without accepting that there will be cases of COVID-19. And we have to make sure that we protect those in the highest risk groups and we keep the healthcare system from being overwhelmed.
Dr. Vivek Goel, thank you so much for your time. You've been very kind.
Great. Thank you. Goodbye.
Dr. Goel also has his own podcast on all things COVID with the goal of giving people a reliable, informed place where they can learn about what's next for the pandemic. You can listen to it on Spotify, SoundCloud, or YouTube. That's it for today. Thanks so much for listening. This Matters is hosted and produced by me, Saba Eitizaz, Adrian Chung, and Raju Mudhar. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.